Have you ever felt sudden tightness in your chest, wheezing, or felt like you just can't get enough air? This could be asthma. And here's the truth most people don't hear. Most asthma attacks are preventable, and most ER visits happen because daily prevention was skipped. Today, I'm going to explain what asthma really is, how to prevent attacks, what medications to use during emergency, and which inhaler saves lives um, here in the US. And still stay till the end because I'm gonna tell you exactly when asthma becomes dangerous. So asthma is a chronic inflammation of your airways. Inside your lungs, airways are inflamed, muscles around them that tighten, they make more mucus. This causes wheezing, chest tightness, shortness of breath, cough, often worse at night and early in the morning. Asthma is not contagious. It can affect children, adults, athletes, and seniors. Common triggers are always there. They just don't come out of nowhere. Triggers are dust, mites, pollen, pets, dental mold, cigarette smoking, cold air, upper respiratory tract infection, exercise, stress and anxiety, strong smells of perfume. Know your trigger. Knowing your trigger is very important. It's the first step for prevention. Now, you need to control your asthma daily. You gotta avoid triggers. Wash bedding weekly in hot water. Use dust mite covers. Keep pets out of bedroom. Avoid smoking. Even secondhand can cause a problem. Daily controller medication, very important. These medication prevent inflammation. They do not give instant relief, but they prevent attacks. Inhale corticosteroids. Most common long-term control medicines are fluticasone called Flovent, or Pulmicort called budesonide, or beclomethasone called Qvar. Must be taken daily even when you feel fine. Combination inhalers are used for moderate to severe asthma, like Advair, it has fluticasone and salmeterol. Symbicort, which has budesonide and formoterol, and Dulera, like mometasone and formoterol, and Breo Ellipta. They reduce ER visits dramatically when used correctly. Other preventive medications like Montelukast, one tablet every day for allergy-related asthma. Allergy control is important with antihistamine and nasal spray. Vaccine, flu, and COVID reduce asthma flare risk. When you have acute asthma attack, what you gotta do? First line rescue medication, short-acting beta agonist called SABA. They open the airways fast. Most commonly, Albuterol, ProAir, Ventolin, Proventil, or Xopenex. They work within minutes. Use with a spacer for better delivery. If attack is moderate and severe, doctor may prescribe you oral steroid like a prednisone and methylprednisone. They reduce airway swelling over hours to days. Emergency treatment in a hospital, they usually give you nebulization with albuterol and ipratropium and IV steroid, oxygenation, and magnesium sulfate in some cases. When is asthma dangerous? Go to emergency room or call 911 if albuterol is not helping you after taking 2-3 doses. You feel severely breathless. You have trouble speaking a full sentence. You got a blue lips and fingernails. Chest is pulling in with breathing. Asthma can be fatal if ignored. Don't wait. One of my family member died. She was 55-year-old from asthma about 2.5 years ago because of severe asthma attack from dust. Final takeaway, asthma is controllable. Most attacks are preventable, but prevention only works if you use daily controller inhaler, know your triggers, use rescue inhalers correctly, follow an asthma action plan. If you or your child have frequent symptoms, talk to your doctor. Asthma control is about consistency and not crisis. Thank you for watching.